Hi, I'm Smriti. In this video, we are going to discuss about toilet training. So many parents were asking how to work on the toilet training. So let us take step by step. So the first step is from the diaper transition to the toilet. To happen that you have to stop using diaper completely, because sometimes if the child is passing susu or potty in the uh, diaper and sometimes in the toilet, it is very difficult for the child to understand that. So when you started working on toilet training, the first thing is completely you have to stop diapers for the day and for the night. Then only you can achieve toilet training. So that is the first step. So when you are, I know it is difficult for you to, when you are going out, you have to take extra trousers and you have to take the child by finding the restrooms, and you have to take them on time and keep always the extra trousers. Like this only we can work it out. So that is the first step. And the second step is transition to the toilet. For susu, most of the time you can put half an hour or 45 minutes or 15 minutes time interval by observing the and understanding how frequently the child is passing susu. So like that you have to take them. And when you are taking, communication system you have to use, so that you can keep a picture or you can use the system. What is the child's communication system that you have to use? I go susu time and then going to susu, so that the child is learning to communicate and going to the right place for doing that. And for potty again it is difficult for, but most of the time when you are observing in a day, you know that evenings the child used to do potty, or morning the child used to do potty, or when the stomach is full the child used to do potty. So at that time you have to be behind the child, you have to monitor carefully. And when you are monitoring carefully, you can see some sort of symptoms that the child is showing before passing. In that moment you have to catch the child and make them sit in the toilet. But many times what will happen is, most of the time to get the habit, we will make them sit on the toilet for a long time, and then the child will start crying, and then child hate to go to the toilet because of lots of waiting. So that is not an effective method. So observe the timing, and when the stomach is full and when they are showing some sort of symptoms to pass, then make them put in the toilet seat, and then help make the toilet seat comfortable. For some children they will be scared to sit, so that you can wear that extra toilet seat and you can put it on that and on the toilet seat and make the child comfortable in that seat. And also you can put a stool so that the child can keep the leg on the stool, because when they are small and when they are sitting in a height, sometimes if the feet is not touching on the floor, then also they won't feel comfortable, and so they are resisted to sit on the toilet seat. So make the seat comfortable, make the light comfortable in that place, and you can be with the child in the initial stages, and make sure that the door is closed. It's not locked, I'm telling, but the door is closed and both of you are inside. So this is the second step. Like that you have to work. Once the transition happened, then you can work on cleaning part also. Then you have to teach the child to clean by themselves using the hand shower cleaning is much easier for our child, and most of the time it is good if you are helping the child to clean from the front side. It will be more, with their motor coordination difficulty, it will be more easy for them. As I told, sometimes we have to put the steps, as I was explaining for in my one of my video for dressing, backward chaining and forward chaining. Like that you have to do the task analysis and see which step is more easy for the child, and start from the easy step with backward chaining or forward chaining. So these are the different steps. So not only taking the child on time to time, you have to use the communication card also. You have to encourage the which mode of communication, it may be verbal or non-verbal, that mode of communication you have to use, and you have to do these things. In this way, if you are working consistently, you will achieve within 6 months. From my experience I'm telling. So I hope these tips will help you. Thank you.